Dr. Prashant Mishra, and I'm the Managing Director for British Medical Journal Publishing Group. We started in 1840. That's when we first published BMJ. At that time, it used to be called as the Provincial Medical and Surgical Journal. With time, with history, we changed our name and we became BMJ, the British Medical Journal. Some of the very famous seminal papers that we published, including discovery of chloroform, which we know, whether it's the role of antisepsis in surgery, the Anopheles leading to malaria, and even the smoking, the linkage between smoking and lung cancer. So these are some of the seminal papers that we published long back. Basically, BMJ is about research, it's about medical knowledge, it's about offering that trusted quality, high quality information that leads to better decision making. We believe that whatever we do leads to three things. One, we strengthen evidence generation, we strengthen the decision making, and ultimately we strengthen the healthcare systems. So one of the initiatives that we have is around the clinical decision support training, something that we've been doing since 2016, where basically we provide doctors with access to state-of-the-art clinical decision support tool that's called BMJ Best Practice. And along with that, there is a huge focus on online CME/CPD via the BMJ learning platform. We have a very logical framework that we've developed over a period of last 7 to 8 years. There are a set of activities that we believe lead to certain outputs, leading to certain outcomes. Outcomes would comprise of better diagnosis, better treatment of diseases, and ultimately the impact, which is strengthening the healthcare system. This is our track record of the countries where we have successfully run clinical decision support initiatives. So this is just a snapshot where implementation of BMJ Best Practice as a clinical decision support tool and BMJ Learning as a tool or as a platform for CME CPD led to significant improvement in the ultimate healthcare outcomes. I'm very happy to share that we propose already an initiative to the Uttarakhand government. We intend to do a pilot in the two districts of Uttarakhand, one being Dehradun and the other one being the Pauri, so that we could have a statewide representation. The idea is to focus on areas which matter to the state of Uttarakhand, things like trauma management, tuberculosis, asthma, and couple of others, MCH, and non-communicable diseases. The pilot that we intend to run is for 6 months period. If successful, we have defined very clear outcomes. Then we intend to run it for another 6 months on a slightly more expanded scope. This is a set of activities, summary at a very high level, what this would entail. We would be creating a customized landing page for the healthcare workers. As I said, the focus or at the core of it would be the clinical decision support tool, that's the BMJ Best Practice and BMJ Learning. Eventually, we intend to also provide the users, especially researchers, young doctors, with access to research to publication, which basically help budding researchers, experienced researchers in learning how to do research, how to do ethical research, and ultimately how do they get their papers published. Again, part of the longer term narrative, the idea is also to offer courses which have been made by doctors in India for the doctors here in India. So we have a small portfolio of courses, diabetes, chronic kidney disease, rheumatology, etc., etc. We also conduct series of live clinical meetings. These are called BMJ master classes, where we tend to bring in the international and the national experts. This is again part of the support that we intend to offer during the pilot. So there is going to be a lot of hand-holding activities from our side in order to enhance the adoption. We also plan to set up a program, oversight, implementation, monitoring and reporting committee. And finally, the call to action that I have today is, we invite healthcare workers, the government, the policy makers in the state of Uttarakhand to embrace this initiative, this pilot that we would be launching very soon, especially in these two districts. Make the best use of this opportunity. We've heard so much in the last session and prior to that around the skill gaps. I think this is a unique opportunity. You know, Dr. Kapoor, when he was talking, he talked about how can one doctor who's sitting at a PSC at least having that skill set, that competence to manage the patient holistically. I believe this is a unique opportunity for the doctors, for the healthcare workers, via the pilot and hopefully via the subsequent stages to really, encash this unique opportunity coming your way. Thank you very much. I want to keep it short. Reason being, I think we've already consumed a lot of time today. Thank you so much.